Good evening, bonsoir, Annie, bonjour, kwekwe. Thank you so much for being here tonight for the third of our 5 lecture series to inform our next strategic plan. Donc, comme vous savez, probablement, Horizon Santé-Nord et l'Institut de recherche d'Horizon Santé-Nord vont élaborer un nouveau plan stratégique pour 2019-2024. Et le nouveau plan stratégique va être limité à 4 pages, va avoir 5 objectifs et pas plus de 25 résultats mesurables à atteindre d'ici 2024. Et ça va être tant pour l'hôpital que pour l'Institut de recherche. So tonight's lecture series is part of quite a comprehensive process. If you are not familiar with all the details, I encourage you to check the website yourhsn.ca. So we've scheduled 5 lecture series. We've had 9 electronic brainstorming sessions. Maureen McClellan, Special Advisor to the CEO for the strategic planning process, has held or is about to hold probably 70 focus groups, at least, internally and externally. And this will all culminate in an electronic brainstorming session by the boards of both HSN and HSNRI in mid-June. So, and then you will see in the fall a proposed draft strategic plan, 4 pages, 5 key goals or aspirations, and 25 measurable outcomes. And I plug the measurable outcomes for the board chair, who's eager to see measurable outcomes to be achieved by 2024. We have a number of members of the steering committee, the strategic planning steering committee, who are here tonight. I'd like to ask them to please stand to be acknowledged. We have at least half a dozen members who are here. Thank you very much for all your involvement in this process. Alors, sans plus tarder, il me fait le plaisir de vous présenter notre conférencière de ce soir qui va également présenter demain matin à un autre groupe. So we're very pleased to host Shelagh Maloney, who will speak tonight on patient-centered digital health solutions and also speak about the growing movement of patient portals and healthcare apps and how this can inform our future directions for both HSN and HSNRI. I think it's fair to say that so far in our consultations, everything related to digital health has been probably one of the most dominant topics. Now we actually need to figure out what to do about it. And that's why we're so delighted to have Shelagh join us tonight. So Shelagh is the Vice President, Consumer Health, Communication and Evaluation Services at the Canada Health Infoway, where she's responsible for driving the implementation and adoption of patient-centered digital health solutions and also patient engagement activities. She also oversees evaluation efforts that measure the benefits of digital health investments in Canada and leads the development and execution of all of Infoway's communications and marketing efforts. Since 2017, Shelagh received the inaugural Women Leaders in Digital Health Award. This award was created to celebrate the top 10 female visionaries who are harnessing the power of IT to transform health and healthcare in Canada. And prior to assuming her current role, she held a number of executive positions in the public and private sectors, where she honed her relationship management and business development skills. Shelagh holds a BSc in Applied Health Sciences from Waterloo and is a certified professional in health information and management systems. She's held a number of board positions at the international, national, and local levels, including as vice chair of SNOMED International and board chair of Digital Health Canada, formerly COACH, Canada's Health Informatics Association. I also want to acknowledge the presence of Jocelyn Kohlmeyer, who's her colleague responsible for the Infoway here in the province of Ontario. Thank you to both of you for being here today and tomorrow. And without further ado, please welcome Shelagh.
So thank you very much. Let me start by saying how delighted I am to be here. When Maureen called Jocelyn and we talked about this opportunity, I thought, this is so unique that I've never heard of a launch to a strategic planning session that kicks off with a speaker series. So, congratulations, Dominic, to you and your team for doing that. It's a really, really interesting initiative, and I watched the videos of the last couple of presenters, and I'm feeling a lot of pressure right here tonight, actually, but I'm thrilled to be here. And so before I start, I did want to acknowledge Jocelyn. Jocelyn will answer any difficult questions you have, so that's, we want to set that off straight away. The other thing I want to say is mes parents sont des anglophones de l'île du Prince-Édouard et Nouveau-Brunswick. Et ils m'ont envoyé à une école française, mais quand j'étais en 5e année, on a déménagé à Regina, Saskatchewan. Il n'y avait pas beaucoup de français là. Alors, ma grand-mère et le français que je connais, c'est juste à propos du niveau de 5e année. Alors, je vais faire la présentation en anglais. Si vous avez des questions, je peux vous répondre en français, mais ça va être peut-être franglais, mais je vais essayer mon mieux. So I will, I think in terms of the presentation itself, I just want to go over the agenda with you a little bit. You know, as Dominic said, I work with Canada Health Infoway, and I just thought it would be useful I'll just give you a little bit of context, and I'll talk to you a little bit about Infoway. I've got just one slide on that. Want to talk about the factors that are affecting the health system. So as you go into your strategic planning session, it's going to be important, I think, to consider your environment and your landscape. And so we'll share some insights that we've sort of thought about. We've just gone through a strategic planning exercise as well, and so these things have been useful to us in terms of our planning. I want to talk about patient engagement. I know Andreas, Dr. Lopakis was your last session speaker, and he talked about patient empowerment. That's a really key part of, I think, any digital health journey, so I'll spend some time there. And then maybe give you a few examples, and then hopefully, well, I know we will have time for some good questions. So I think my objective tonight, I want to do two things. I want to share my passion and our passion for digital health, and sort of convince you that there are tremendous benefits around digital health, and that they should be an integral part of your strategic plan. And based on my conversation with Dominic earlier, I don't think that's going to be a tough convincing. And then the other thing that I want to do is really just, I think, share with you some examples and really around the art of the possible, and give you, this is not future, this is what's going on today now, mostly in Canada. And so just to present some examples for you to consider as you're going through your strategic planning session. I will talk, and I should say, because there are lots of people here who will be actually responsible for executing that strategy, it's not easy. And I do, and Jocelyn said, well, you got to include some of the hard stuff, because it's not easy to do some of this stuff. So I want to acknowledge that, and we'll talk about that a little bit. So Canada Health Infoway, how many people have heard of Canada Health Infoway? Oh, that's not bad. About 11% of the Canadian population has heard of Canada Health Infoway, so we're not a household name. That's good, but about 3 years ago we were only 4%, so our family and friends have grown. We have all large families. But Infoway was established in 2001. We are 100% funded by Health Canada. We're a national not-for-profit organization. Our members are the deputy ministers of health from all the provinces and the territories, including the federal government. And so we also have an independent board of directors, and that's made up of sort of half public sector. We've got 5 or 6 deputy ministers of health on our board, as well as some folks from the public at large. And I tell you this because one of our roles is really to sort of establish that navigate that healthy tension that sometimes exists between the federal and provincial governments. Our mission is to improve the health of Canadians through digital health solutions. And so we believe that technology is a key enabler, not the, but a key enabler to improve the health system. And so that's what we do. And early on in our evolution, Infoway was very much about putting infrastructure together, and there was investments across Canada, including here, around establishing diagnostic imaging, so getting rid of film, digitizing records, lab information systems, drug information systems. So when you think about, you're building a house, you have to have the planning. If you're going to share information, you need to have it in a digital format. So that was a lot of the early heavy lifting that Infoway was doing and engaging with our jurisdictional partners on. Then we moved to sort of a focus to clinician engagement and improvement. In 2007, we had about 27% of physicians in Canada had computers, electronic medical records in their offices. That number, that national average, is about 85% now, more so in some of the provinces that BC, Alberta, Ontario, less so in some of the Atlantic initiatives. So that was a big focus for us. And now our focus has very much shifted to the patient, now that we've got some tools in place, and we've just launched, as I said, a strategic plan. And one of the big pillars of that is to provide Canadians with their health information and to provide them with digital tools and services to improve their and their clinicians' ability to manage their health. So that's, sort of our strategy in a nutshell. Happy to answer more questions about Infoway as we go on, but I'll just leave it at that for now. What I thought I would do to start is play you 3 videos. These are ads that we did. We, about 2 years ago, undertook a public education campaign. We really wanted to make sure that the public was aware of the benefits of digital health. We do public opinion research, and we send out surveys to Canadians every year to really find out what their attitudes and perceptions are. And so we know that they really understand what the benefits of electronic health records are and digital health. And so this was, I just want to give you a couple of examples of some of the ads that we did play. We hope they're a little bit fun, they're a little bit cheeky, they're a little bit provocative, but I'll just maybe play them and then we can have a little bit of discussion around them.
Digital imaging lets your x-rays get around to your care team, even when you can't, which is one more reason to love digital health.
Does anyone ever see that ad that played on TV? One person's, yeah. Most people remember the jingle and not the ad, but so glad there's one person, great. And we just spent a couple of hours with Gaston and the folks here and know that, I don't know if everyone knows this, but Neodin this is the central repository for, 14 million diagnostic images, is that what you said? So lots of activity is here. So that's a good one. And now this one is about, I'm not sure what the next one is, so why don't you just play it and we'll...
You have reached the after-hours voicemail of your family doctor. Please call back at a time less convenient for you. Thank you.
We've had a little bit of controversy over that ad. But, and our point was we were trying to be cheeky and provocative. We weren't trying to be disrespectful, and I think that was and it was interesting because we went to all of the provinces, as I said, our jurisdictional partners, and we showed them, we said, this is what we want to do. And it was interesting because we had 2 reactions. One reaction was, we don't offer that service in our jurisdiction. Don't do that in this, we don't want that ad to play in our jurisdiction because we don't want to raise expectations of people asking for this. The other reaction we got was, this is great, we don't do this in this jurisdiction, we really want the public to demand these things, please play it so we can get the initiative. So no publicity is bad publicity, I guess, but that was, so it's just a little bit of background on that ad. And then we'll just one more for you.
Sir, you're at the hospital. You were in an accident. Are you on any medications?
So I just want to give you a flavor. That, again, was another ad that we played. And there are a few others that we have that I won't play for you tonight. You'll notice that there were no people in any of those ads, and we did that purposely for 2 reasons. The first one was because we really wanted people, these are situations, and these ads were directly as a result of the benefits that people had identified for us. And so we wanted people to see themselves in these ads, and I think everybody can relate to some of those issues or see themselves or know somebody who was in that situation. The second thing is there's no people in this ad because we just saved a lot of money by not using actually actors. And the other one, we have Sydney that trained trained cat and Seth the trained crow in our other ads. I'm not sure if that goldfish was an actor goldfish or just somebody's, but that was a lot of fun doing those kinds of things. So now I'm going to switch gears a little bit and talk about the landscape. So talking about a number of forces that are shaping the Canadian healthcare system. And I think, I'll talk a very high level around these, but demographics, healthcare costs, technology, and then consumer demand. So I think everybody knows the demographics are changing. Our population is aging. I think for the first time in our history, there are more people who are over the age of 60 than are 14 years and younger. So when you think about that, imagine what that means to our healthcare system. So we have more chronic diseases. We have more chronic conditions. As you live longer, we have more degenerative diseases like arthritis and those kinds of things. So the burden of chronic disease is heavier. You think about the demographics as well, and our workforce is aging. I think the average age in Canada of a nurse is about 46 or 47 years old. So think of the implications of that. And then, of course, we have some lifestyle issues, higher levels of obesity and other factors that make us rely on the health system a little bit more. So I think all of the population changes that we're seeing are really increasing the demand for health services. I would also argue that they're making the case for the need for new models of care. And that theme will continue throughout the presentation. This is a heavy slide. I'm not going to go through it. It just gives you some healthcare cost information from the Canadian Institute for Health Information Forecast 2016. We spend a lot of money on healthcare. And we have, at our board meetings, we're national organizations, so we have board meetings across the country. And I remember one of the board meetings, and we had a Minister of Health from that particular province came, and he addressed, he was a dinner speaker for the board. And one of the things he said, and in each of these charts talks about the percentage of the provincial budget that is spent on healthcare. And there's some pretty high numbers there, 35, 40, 45%. And this Minister of Health, I remember very clearly, he said, no minister, none of his ministerial colleagues wanted to have the dubious honor of being the first Minister of Health whose provincial budget on healthcare exceeded 50%. We're getting close. So that's the point that I wanted to make on this slide. Again, I think the need for changing the models of care potentially. We can't sustain it if we don't do something different. Technology is the other one. I don't have to, technology is disrupting our lives everywhere. The way we eat, the way we live, the way we, travel, it's the way we live has been disrupted by technology. And there's just a few things here that identify some of the new emerging technologies and some of their applications for healthcare. Virtual reality, and I wish I could remember the name of the app because I'd love to give them credit, but I just can't. But it was a gentleman who, based on the experience of his mother-in-law, created this virtual reality for folks in hospital or in long-term care homes. It said, I never have been to Paris. I would like to go to Paris. And he created a virtual reality environment. Or, I've never been hot air ballooning or driven a race car. And so as distractions, but a critical part of the process. Artificial intelligence, augmented reality. How many people have a Fitbit or any kind of wearable device that they use to track? We just did a study with Guy Paré from the University of Montreal, and really interesting data on Canadians are increasingly wearing devices that will track and monitor their vitals. And now they're so sophisticated that they can predict based on your gait whether you are at risk of a fall, or they will predict an irregular heartbeat before it actually happens. So that stuff is real and it's happening. It's some really great technology that's out there. The Internet of Things, sensors on stoves to make sure, aging mother living at home is turning off the oven when she's finished, or, the fridge hasn't been open 3 days. Is anybody eating? And those kinds of things. So those are realities. Those are things that are happening today, and technology will and has tremendous potential, I think, around the healthcare system. And then the last thing I want to talk about is consumer demand. Again, we have certain expectations based on what's happening outside of our health context with respect to technology. And as I mentioned earlier, we do public opinion research, and we ask Canadians every year what they think about healthcare. And I can tell you, across the country, regardless of where we are, and across the years, when we ask Canadians what they want from a digital health perspective, these 4 things come up. They want to renew prescriptions online, they want to be able to book appointments online, they want access to their health information, and they want, one moment please. They want, virtual visits. They want to consult with a provider. So maybe does that resonate? I see some nodding heads. That makes sense to people. So how many people can access one or more of those kinds of services right now today? That's pretty good. I think, what's that, maybe 5%? So I just want to draw your attention to this yellow line here on the graph. In 2014, we asked Canadians, so again, these are the things that you would like to do. How many of you can actually do that? And the number was between 6 and 7% of Canadians could access one of those 4 things. The good news is in 2016, the number doubled from 2014. So we went from 7% to 22%, not great, but still we're getting there. And so in 2016, 22 to 27% of people could do that. But the large bar in each of those areas, 60 to 70%, that's the delta. Those are the people who can't access those services but would like to. And would if they could. So that's when we talk about it, Infoway, and you'll see a lot, those videos were based on those things that Canadians want. And our investments around that are very much targeted to, again, access to information and digital health tools and services that will help Canadians manage their care. And I think one of the things I want to talk about as well is this whole concept of the engaged patient. Now, I know at the last session, Dr. Lapakis talked about this, but it's really important, and it's important for a couple of reasons. When we talk about the benefits of digital health, we always have some naysayers, and physicians will say, well, my patients don't understand their information anyway, so they don't want access to their health records. Or patients will tell us, I don't want to see my lab results online because I won't understand them anyway. Or I don't have the right to access my health records. I don't own them. And so what we did is we collected this information and we had this myth-busting campaign. And so, for example, people say, well, I won't be able to read my lab results. How many people have seen lab results, their own lab results? And could you understand them more or less? I think what the issue is, especially people with chronic disease, you might not understand them the first time, you might not understand them the second time, but if you have a chronic disease and you see your lab results, usually you will understand them, and you understand what's normal for you and what's not the new normal. And so what we did was we actually, part of our evaluation team at Infoway will go and do some research that actually will quantify some of these benefits. So we went in British Columbia for a number of years now. They have, Accelerus is the name of the company. I can't remember what the commercial name, My Health, I think it's called. But every British Columbian can see their lab results within 24 hours of them getting the test done. And so we asked them what they thought about that. And you see, when people have access to their own health information, and the numbers are 95, 94, 93% of them, they are more knowledgeable about their health condition, they're more confident in their ability to manage their health condition, and they have better interactions and discussions with their family physicians. They are more engaged and empowered. And guess what? An engaged and empowered patient has better health outcomes. They just do better. And so that's, this is a line that I always use as a quote, and I really like it because this was Leonard Kish's, he was then, I think, the CIO at one of the big health systems in Boston. And he wrote this blog, and he talked about the patient engagement. If it were a drug, it would be the blockbuster drug of the century. So imagine a drug that improves your outcomes, that saves you costs, that saves the system money. If it were a blockbuster drug, if it was a drug, it would be the blockbuster drug of the century. And so this quote gets used a lot, but the second half of this blog said, and medical malpractice not to use it. And so I just think that, if patient engagement were a drug, it would be the blockbuster drug of the century, and it would be malpractice not to use it. And so, when you're thinking about a strategic planning process, I strongly encourage that patient engagement involvement, and clearly you're on that track with the steering committee and other initiatives and the focus groups and the engagement that you're planning. It's really critical. And it's not critical just because it's the right thing to do. It makes a lot of sense from a dollars and cents perspective. And so I'll share this information with you. We commissioned the Conference Board of Canada in 2012 to do a study for us. And they quantified this, and they said if Canadians could do two things. If they could renew prescriptions online, and if they could see their lab results online, we would save 47 million inpatient visits per year, not inpatient, I should, in-person visits to a family physician, 47 million visits per year. And then we went through that and then quantified that to say that 70 million hours of their time that they would get back, almost 20 million hours saved in work, and then another 51 million in terms of leisure and education and school and things. And then that translates to a bottom line with respect to it putting money back into the Canadian economy. So patient engagement makes sense from a common sense perspective, and it makes sense from a dollars and cents perspective. So I switch gears just a little bit more, and maybe just again, I want to give you a few practical, very specific examples. Again, this is not a presentation of the future. This is what's happening now in Canada. So another video, and I would encourage you that we do have on the Canada Health Infoway, we have a YouTube site, we have our website, Infoway, info.ca, and we do have some videos, and so we do try to record, and again, trying to make the case for digital health and share patient stories. And so this particular story is around telehome care. In Canada, we are leaders in telehealth, and especially for rural and remote populations, of which we have a lot of in Canada. We are renowned for offering telehealth services. And do you know what one of the biggest users of telehealth is? It's telepsychiatry, it's mental health, which again is a very big and important issue for us right now. And so, we just spent a couple of hours earlier with the folks here, and we know, and they've sort of underlined for us big time that this center here is a big telehealth hub, and do it as a matter of course. And so I think that's a really good kudos to you folks. This particular one is telehome care, so remote patient monitoring. So Nancy, who you'll meet, is a congestive heart failure patient. So we did it mostly with congestive heart failure and with people with COPD, chronic obstructive pulmonary disease, lung issues. Most of them are elderly, most of them are frail, and so when they get discharged from hospital, they're sent home with a blood pressure cuff, usually a scale, and something to measure their oxygen. And then they, with Bluetooth enabled, relay that information to somebody on the other end who reviews their vitals and takes action if necessary. They get coaching and they learn from this. So you'll see that in the presentation. What I'll tell you about this telehome care initiative and the investments that we've made at Infoway around this, there are over 30,000, about 31,000 Canadians who have benefited from this, and we're seeing 35 to 65% reductions in emergency room visits and 50 to 75% reductions in hospitalization readmissions. So again, think and attach a dollar sign to that, and not only that, but the patient convenience. So maybe, Justin, you want to play that video?
For many years, Nancy Hike has given her time volunteering in her community. It brings great joy to the 71-year-old grandmother of 3. Despite a diagnosis of chronic obstructive pulmonary disease, she remains active and independent.
Well, even when I was working, I did a lot of volunteering. I enjoyed helping people, and it makes me feel good.
Nancy is enrolled in a community paramedic program that provides digital health tools in the homes of patients so they can measure their vitals, such as blood pressure, weight, and oxygen levels. The information is sent to Middlesex London Emergency Medical Services, so paramedics can intervene before minor issues become more problematic. Scott Rector, a community paramedic, says the program improves patient care and avoids complications before they escalate.
Remote patient monitoring has changed the care in the community for patients simply by efficiency. So the paramedics are getting direct information from the patient, and we're able to communicate that between the patient and their healthcare provider, physician, or ourselves, and we can actually attempt to keep the patient in their home. So with simple coaching and some teaching along the way, we can work together to keep that person in their home.
That's exactly what happened the day Nancy's vitals prompted a visit from Scott.
The day I had a lot of problems with my blood pressure was quite low, and I was quite dizzy and very weak. And when Scott, the paramedic, spotted what was going on in his office, he came right out and helped me get settled down, and was very good. In fact, he called me an hour later to make sure everything was still okay. So I'm very impressed with them all in there.
Nancy says the quality of her life has improved since she has been on the program, and recent studies show she is not alone. According to a report from Ernst & Young, patients who are part of remote monitoring programs are highly satisfied and experience fewer emergency department visits and require less hospitalization. And according to researchers from Queen's University, being part of remote monitoring programs reduces patients' stress and anxiety, knowing that someone is monitoring their condition.
Since I've been on the remote patient monitoring, I have not been to the hospital at all, or a walk-in clinic. And before then, I was there at least once a month. It has really made a big difference. And I'm able to work around the house. If there's a problem, I know enough to stop, because you can actually see what your blood pressure is and everything. And otherwise, I would just try to keep going.
So there's just one example of somebody who's benefited from the telehome care program. There's one, Wendy in Saskatoon, the similar thing. In the very end of the video, she said, "It's given me the joy of my life back." And it's just a really powerful video. It's really nice to watch and nice to see those stories and hear those stories. Because I think we have these statistics, and 31,000 and 55%, but these are individuals' lives that we're affecting, and they are really benefiting from these kinds of programs. The next example I'm just going to share is an American example. This is the Mercy Hospital in St. Louis, and they have lower costs compared to their peers, higher patient satisfaction rates compared to their peers, and they have better outcomes compared to their peers. What they don't have are beds. This is a virtual hospital. And so what they do is they are set up as clinicians, and they have these kinds of screens, and they're monitoring ICU patients, and they're monitoring patients in their homes. And then again, recognizing seeing and understanding where people are in trouble, and they can react more quickly. And so it's not an acute episode. They can get there before it becomes a significant episode. So, that's something as you're doing you might want a virtual hospital. Dominic, when you do your HSN, you could have HSN and HSN virtual. So there's something that just to sort of think about. I'm going to play you another video, and this is patient access to health information. Talked about patient portals. That's something that people, again, want access to their information. There's all good reasons to do that. This next video that you're going to see is Tony. She's a member of the Cowichan tribe in British Columbia, and they have a patient portal. It's the Closing the Circle of Care is the name of this initiative, and this was First Nations, by First Nations, developed for First Nations, by First Nations, and it's a community electronic medical record that combines with a patient portal. And you'll hear Tony talking about how she uses it. The good news and the nice story around this one is that we are now extending and expanding, scaling and spreading this initiative across the country. So at the end of the project, this will be rolled out in 227 First Nations communities across 10 provinces. So that's something that's an initiative that's been very, very well received, and Ontario will benefit from that as well. So maybe we'll play that video.
The vast majority of Canadians want access to digital health tools and capabilities, and Canada Health Infoway has invested in several initiatives that are connecting patients to their health information. The Closing the Circle of Care project in British Columbia honors the Cowichan tribe's Indigenous teachings and approach to care by reinforcing the importance of empowerment and the need to work collectively for improved health and wellness. Tony Williams is a busy mom who accesses her family's medical information securely online thanks to the initiative.
I've been using digital health for about a year, and primarily I use it to update information for my daughters, connect with service providers, and stay up to date on immunizations and to ask questions. So being able to email a nurse at my local health center it kind of expands on the nurse's line, being able to ask questions and figure out where I am and should I be more concerned about something.
Research demonstrates that when patients and caregivers have digital access to health information, patient outcomes improve. A big benefit for busy parents like Tony is the ability to manage their family's care on their own schedule.
I think oftentimes with parents, everything is go, go, go all day until the kids are finally in bed, and that's when you remember some of the small things you were supposed to do. And so being able to message about an appointment, message a concern to our health care provider, and to get a response is extremely helpful, because that won't usually cross my mind till 9 o'clock at night. And then I think, oh my goodness, I was supposed to do this 2 days ago. So yes, I do find it really helpful and saves me time.
So just an example of a patient portal, and very similar stories across the country. Last example I'll provide is around e-mental health, and I think, I don't have to tell you, mental health is a big issue, 1 in 5, especially access issues around mental health, youth mental health in particular, or mental health for vulnerable populations. And a couple of things that we did, we partnered with Kids Help Phone, and actually, I think you're all familiar with Kids Help Phone, right? The phone service. As of February, we're piloting texting. So Kids Help Phone, now kids can text. And I don't know about you, but my kids do not use the phone. So texting is what they do. And so we started the initiative in February in Manitoba. And we just actually met with them a couple of days ago, and they gave us some of their preliminary numbers. And it's really fascinating. They have tripled their access points, tripled the capacity now in Manitoba for Kids Help Phone, and they're not sure where the demand will end. Have they saturated the market? They don't know, but they continue to get calls. And one of the nice things is that when the Humboldt, Saskatchewan, the van tragedy, the bus tragedy rather, happened, they recognized that they needed to do something, so they did very targeted marketing in Saskatchewan, mostly in parts of Alberta, and they said, if you are feeling stressed about this, or if you want to talk, here's a number. And they saw a spike, a peak in those numbers. And the nice thing about this is that Kids Help Phone, this new solution they have, it's powered by Crisis Text Line, which is the digital solution, and it has amazing data analytics capacity, and you've heard of this, big data, and so it takes all the information that it gathers. Again, the kids like this kind of thing because in a lot of the mental health apps, you're not walking under something that says, mental health department, or you don't have to come out. It's completely anonymous if you want it to be, and they can go on your own time, and so it's been very, very helpful from that perspective. And they do ask young people to fill out a survey or to answer some questions when they're done, completely optional, and they're getting some really good information about the quality of the service. So one of the things they shared with us a couple of days ago was when they asked the kids, if you didn't have this service, what would you have done? And about 5% of them, not a big number, but 5% of them said, I would have gone to the emergency department. So again, that's good information to know in terms of making a case for funding this stuff on a regular basis. As you know, Kids Help Phone is reliant 100% on charitable donations. The other thing that Crisis Text Line does is the algorithms, they are used to understand the analytics and the systems and what's making it work. So for example, one of the things they told us is when a young person is suicidal, they don't usually, they don't get as worried when they say things, I want to kill myself or I want to die. But when they actually talk about the mechanism that the means by which they want to, potentially end their lives, pills or guns, that's when they escalate to, and they can actually do an active recovery where they'll send EMS services, and they had to do about 24 of those in Manitoba since February. So very, very impressive, and they told this wonderful story. I'm not sure I'm going to be able to tell it without, I started crying the first time I heard it, so I should probably not start telling you about it because I may lose it, but a young autistic boy who had no other way to express himself, and he used this service, and the story is lovely, and he said, will you stay on that, because I can text, I can't talk, I don't express myself very well, but draw a picture of a boy lying on a bed and draw water. He's underwater. That's how I feel. And so the counselor was able to walk him through and say, okay, let's think of some strategies. Now you take a pen and paper and you draw. How can we make you float? And so they had a wonderful interaction. And this little boy had never had the ability to do that before. So he's very appreciative of that. So you think of those stories, and there's thousands of them and tens of thousands of them. And so that's the kind of thing I think that e-mental health services allows. And that's a really good example. The other investment that we're making in Ontario with Ontario Shores Mental Health and the CAMH and a couple of other facilities is around a big white wall. This originated in England. And in the UK, it's an anonymous, it's a website, and you can go and you can be Mickey Mouse, or you can use your real name, it's up to you. And then you post things on the wall. You can poems, pictures, writing, and then you talk and you interact with other people. And people have found it, and especially when they're waiting for a service, because you might get into a psychiatric service, you might have a 6-month or 12-month wait. In fact, in one of the ladies who, we've got a video on this, I won't show it, but it's on our website if you're interested, in Jane, and what she said was she used the service a lot after her therapy sessions because she found that she was quite agitated after her therapy sessions because she had gone through so much. So she found it very useful. And again, completely anonymous, but they have counselors. And so if you feel that you want to talk to somebody, you can. Or if they're sort of trolling the walls, and if they think that you need extra help, they will actually sort of break the glass, as it were, and ask you if you are interested in some kind of intervention. So really, really wonderful opportunities, I think, and potential in the mental health space with the mental health services. So my job was just to show you the art of the possible. It was a sort of, I don't have to solve any issues, and I don't have to be the one actually implementing the strategy. But I think it's important to have these kinds of conversations because there's one thing about saying, yeah, we need to have this, but it's not easy. It's hard. And there's a lot of reasons why it's hard. And I think when you think about privacy and identity management, so if I'm accessing a service, if I'm accessing a portal, personal health information is private and it's confidential, and the people who are custodians of that data have a responsibility to keep it that way and take that responsibility very seriously. And we have to make sure that we are doing it right, and there's lots of privacy legislation that helps us do that. The downfall is the privacy legislation in every jurisdiction is similar, but it's not the same, and there's data sharing agreements, and so it's a big task to do that. I had a conversation with somebody the other day that they said it took them 2 years to negotiate a data sharing agreement with 2 hospitals. This was an academic sort of university setting, trying to access data from 2 hospitals, 2 years to negotiate that data sharing agreement, or 3 years for 2 years, or 2-year agreement, something, but an exorbitant amount of time to do this. So we don't want to create barriers. We don't want to put the unnecessary and be so risk adverse that we're going to do ourselves a disservice. But I do want to acknowledge that that's something that we need to take very seriously. Data silos is another thing, and we talk about, everyone wants a patient. I want access to my health information. Well, some of my health information is at the local hospital, some of it's in my physician's office, some of it is with the local lab, some of it is at my pharmacy, some of it is in my own personal records. And so I want all that information. And so our moonshot at Canada Health Infoway, what we really want to do is, everybody has a cell phone. What we'd love to do is when you buy a new cell phone, the apps are loaded on your phone. Wouldn't it be cool if you had an app that was loaded on your phone, every Canadian, that you then registered and identified yourself, and then you would have all the sources of information in one spot that you could see. Oh, and by the way, it says, oh, Sheila, I see that you're diabetic. Here's the number for your local diabetic clinic. Those kinds of services would be, that would be the ideal scenario. What that takes, though, is liberating the data. We have a lot of data silos, so with that information, and making the connections between the two and saying, okay, I want all the information that belongs to Shelagh Maloney, and me, Shelagh Maloney, not Shelagh Maloney, my aunt, or Shelagh Maloney, a complete stranger who lives in Australia. So those are the kinds of issues that we have to deal with, and the governance around, all this information. Who owns it? Who's responsible for it? How does that work? And I think those are the kinds of issues that we will have to grapple with, and increasingly will have to grapple with as we get more technology advanced and as we have more information. All the data that comes out of my Fitbit, where does that go? So I just want to, acknowledge that it's not an easy task, and especially having a real appreciation for if you're the person who's trying to make this happen. We need to be patient around some of this stuff. And then the third challenge I'll sort of identify, our board chair, Dr. Peter Vaughan. So he's a physician. He was a deputy minister of health in Nova Scotia. Most recently, he was in the Air Force. He's an entrepreneur. He's a technology geek. And he did a talk a couple of days ago, and he talked about this failure of the imagination. And I really think in healthcare we're, there's a lot of status quo. We're very risk adverse for some of the reasons I identified earlier. And so to really think of where the future is going and think outside the box, as it were, and really understand the capability and the power, I think that's a real challenge for us potentially in the health system. So my last slide, I just want to leave you with a few parting thoughts and some conclusions, and then we can have some time for questions and discussions. We have a great healthcare system in Canada. When we access care, the quality of the care that we receive, I think, is very good. But we have some issues around access to care. When you look at the Commonwealth countries, Canada ranks 9th or 10th or 11th out of 11 countries in terms of access issues. So ability to see wait times in emergency rooms, ability to access physicians same day, family doctors, those are the kinds of things. And I think, I hope that I've sort of convinced you or set the stage in terms of technology as a really big enabler to transforming the system, to give us a system that we all want and that we all deserve, and one that's going to be sustainable for us and for our children and for our grandchildren. But I also want to make the point that it won't be easy. I think embarking on a strategic planning session is a wonderful thing, and to have the community engagement as part of that is really, kudos to you for doing that. But I think it will take a real focus, and it can't be a whole bunch of things and be all things to all people, but a real singular focus. And my suggestion, and I think sounds like you're moving in the direction, is that focus to be improving the patient experience, whatever that patient experience might be. And it might be something as easy as making it easier to navigate the halls and find out where they're going. I recently, my mother in Ottawa had an appointment with a cardiologist. She's 88 years old, and we sat for about 4 hours to wait to see the clinician. He did a wonderful job, and the cardiologist said, I want you to know you have my undivided attention. He spent all the time that he needed with us. We were in with him over an hour. Really appreciated that. But my comment to him as we were leaving, and as respectfully and I was respectful, but I said, you're booking 30-minute appointments. If you're spending an hour with each of your patients, my mother's 89, and she won't go to the, drink anything. She doesn't want to have to go to the bathroom, and I'm telling you too much now, but I think you get the point. Is we can make the journey easier for patients, and if we do that, if we do the right thing, I think we will do the right thing for the system, and we will do right things to improve our health and improve the health of the system. So with that, I will close there. Really welcome your comments and questions. Here are my coordinates if you want to get in touch, and I'll turn it back over to Maureen. Thanks.
It was exactly what I hoped it would be, so thank you. Yeah. So for those who've not been to a session yet, our format is a question and answer now, so you've probably got some things in your head, and you may want to ask questions, make comments. Janet's part of the loyalty program. She's been to these sessions, so she knows you got to stand at the mic, and so that your question can be heard. This is being videotaped, so it's helpful because anybody that goes on to watch the video, it gets to hear the Q&A. So Sheila, this is your opportunity to interact with us. Perfect. Thank you.
Sheila and Jocelyn.
Right. So this is one of the challenges. So I'm the VP Research and Scientific Director for our Research Institute here. And we have all kinds of opportunities to apply for grants, do research, all of this kind of thing. But a colleague of mine, I was at a national meeting yesterday, and he said this thing, and keeps going through my head, is that we privatize the profits and socialize the risk. Mm-hmm. And so whenever we're getting into doing hard things around, you've talked about ways we can access the system and make appointments and do all these things that really don't involve any kind of data collection. And then, and you talked about that, but the challenge is that when you come up with a new idea, is that you can't think about a way to make money off of that right away. It's really hard to get into this business, because I am also a geriatrician.
Mhm.
So dealing with frail older people is not the woman that knew how to put the blood pressure cuff on, and so managing things like heart failure and your 89-year-old grandmother having to sit for 4 hours to wait. I mean, she was exhausted. So the people who were getting something out of that appointment were her family members that still had the resilience to be able to do that. So I think there's some real challenges around our highest and risk and most vulnerable and marginalized populations that I think are really where we have to put the investment and understand that the return on the investment is not immediate, because these are hard problems to solve. So your thoughts on kind of the way forward around that.
Yeah, great comment, and thanks for bringing that up. Because I think, so a couple of things. This is not for everybody, and I think what we want to do is those people who want to access the system and can access the system and have the capacity, physical and mental, to do that, are the ones that want this, that should be using it, so that we can have more time to spend with those people who really need the face-to-face, who want, and sometimes, a visit to the physician is more social than it is physical about your well-being. So that's one comment. I think in terms of marginalized and vulnerable populations, I think digital health to some extent can actually overcome that. Imagine if rather than us being at the hospital at 3 or for a 3 o'clock appointment that doesn't happen till 5, if we could have a televisit and consult, and so my mother could stay in her home, and then she would just be dinged 10 minutes ahead of time, and that would work so much better. So I think digital health has capacity to actually increase access for those marginalized and vulnerable populations. Some people, they can't afford to take time off work for a doctor's appointment. They can't afford to take a bus and those kinds of things. So I think that's one of the issues. In terms of your profit, I'm really glad that you brought that up, because I think one of the things that is an actual principle for us is that this should not be patients should not be paying for these services. This should be free, and I think that's one of the things. Another one of the challenges is when we're doing some of these initiatives, what's the sustainability model? Because the system can't pay for it. So we have to, and that's why we're doing a lot of these benefits evaluations, to say we want to make the case that, and in fact we went to one of the provincial governments not long ago, and we said, if you're paying for these rehospitalizations, that if we can prove to you that we can provide the same or better care for the same or less money, will you change your policy and allow for these virtual visits? And so it didn't work, it didn't happen. But I think that's the case that we want to say, that, if 5% of the people who are getting e-mental health services through Kids Help Phone, a texting service, would have gone to the emergency department, how much system is your saving? So take those savings and reinvest them in digital technologies that will help. So that's sort of my response to your comments and questions, but thank you very much. I appreciate those comments.
So my question was actually kind of along that same line as to the mHealth and how that's going to really help and improve patient care, and how is Infoway really working to move forward with the mHealth initiatives?
Yeah, so mHealth is mobile health, and it's interesting because I think mHealth is sort of, and one of the studies and the research on some of the wearables is that mobile health is sort of, when you think about the people who are using them, they skew to a little bit on the younger side, and usually a fairly higher socioeconomic status. So the people who are wearing the Fitbits are probably not the ones who need the Fitbits, as it were. But having said that, I think it was Dr. Kendall Ho, who's a researcher out at UBC, and he spends a lot of time looking at these kinds of things. One of the things, and what I thought you were going to ask about, was digital literacy. And so what he's spending a lot of his time on is how can you design and develop these things so that they're easy to use. But he also found that they did an experiment where they gave it was some kind of wearable device that tracked vitals, and they gave them to a big population, and the uptake was for people who, we call them health activists, so usually middle-aged women or younger who have children, who have older parents they're looking after. They're activated, they're motivated to take care of themselves and manage the health of their families. They were the ones that are adopting this technology most. They are also the ones that were dropping them after 2 months. But there was sort of an older cohort of, this was a blood pressure monitoring system, older men who actually, the adoption rates were low, but they stayed on the system. So it was actually helping for the ones that did do it. And they were sticking to it because they were actually seeing the results. And so, so that's one comment. Then your actual question was, what's Infoway doing about it? So I think we are looking at, one of the things as part of our access strategy is we've just signed memorandums of understanding from all 4 of the Atlantic provinces. And so what we want to do is use them as a hub to start some of this initiative and some of these activities. And we've gone to them and said, what are the priorities? So the 2 priorities for these access initiatives will be around patients accessing health information and the mental health space. And then e-referrals and e-consults was something else that they expressed a desire to do. So we're trying to develop a national play here so that we can scale and spread and make these systems available across the country. And then tackling some of these hard issues around identity management that really need some national focus, and working with our jurisdictional partners to try to really work through some of these tough questions and some of the technology that requires tough decisions and some investment and some deep thought.
First of all, thank you very much for your presentation. After hearing it, I actually thought I was going to text you my questions and something I've been asking. But being in Canada, being in Northern Ontario, we do really have a lot of rural areas. What does Infoway do in lobbying the major carriers to have more telecommunication towers put out there so that the people in the far-reach areas we can access? Because we're limited to their access to the airwaves for us to be able to contact them. And I'm curious to know if Infoway does anything with that with the major carriers.
That's interesting because when we, as part of that early days, we had about 10 investment models, and one of our investment programs was telehealth. And we set up objectives for each of our telehealth initiatives, and one was to make sure that telehealth was supplied in minority languages, including First Nations languages and French or English, depending on what community you were in. And the other objective for the telehealth program was to have all communities north of 60 wired. And we achieved that objective. It was interesting, though, because we had recently conversations with the folks at Health Canada and the First Nations Inuit Health Branch, which is not called that anymore, I know. They was talking about connectivity, and that was a big issue for them. And we said, but I thought north of 60. It was like, yeah, but it's not north of 60, it's south of 60 where the issues are now. And so the other thing that you raised is around advocating for and trying to influence policy. Historically, we haven't done that. I think we're increasingly moving to that, and I'll give you another example, and is around virtual visits. And so we invested with the province of Nova Scotia. They have a province-wide patient portal, and it allows for patients to email their docs and have a virtual visit. The issue is that physicians don't get paid for a virtual visit. They only get paid if it's face-to-face. And so now we recognize that if we want to move this digital agenda forward, we have to tackle some of those tough policy issues around privacy and around remuneration and around access points. So one of our key partners on this we have a national prescribing service that we're launching called Prescribe It, and we are working with TELUS as the partner that we're using. And so it's an interesting point. I don't think we've specifically lobbied around that, but I think we recognize increasingly we have to get into more of that policy space if we want to move the agenda forward in any way. Come on, somebody ask a tough question for Jocelyn.
actually about prescribing. And maybe tell me if this is too very specific. But I've noticed the bits and pieces that I've been able to follow about that program. I haven't heard much about hospital discharge prescriptions, and that's a huge source of disconnect. I'm not a pharmacist.
Right.
That's a concern to me. Do you have an update on that?
Yeah, great question. So for those of you who don't familiar, Prescribe It is our national e-prescription service that we just launched fairly recently. So we launched in Ontario and Alberta, so there's 2-3 communities in Ontario. And one of the reasons, when you launch anything at a pan-Canadian or national level, it's hard. And so what we wanted to do, and what we, one of the reasons why we've been successful in the Prescribe It rollout so far is that we've been very singularly focused. So right now it's provider, prescriber, usually family physician, to pharmacist. And so we recognize that the plan is to move to hospital-based discharge, dentists, and so that's part of the rollout plan, but we're focused and trying to keep that scope narrow for the short term. But that's the plan longer term.
Good evening, Sheila. Thank you so much for your presentation.
Thank you.
Very enlightening for sure, and as part of the largest aging demographic, I'm looking at this and thinking so much to do in such little time.
I'm with you, sister.
Anyway, I'm just trying to wrap a visual into my mind as to how this would look when we're talking about making phone calls for the aged. My mom passed away a couple of years ago at 95. I've been through the entire gamut of this journey, a lot of which I wouldn't want to have to go through personally, and hopefully by then some of it will have changed. So I'm looking at, for example, the telephone contact. And if you're having an issue or whatever I mean, there was talk of patients being given iPads and being able to communicate that way, but when we're looking at this demographic, there are so many who are technologically illiterate and other reasons that they wouldn't be able to tie into that mode of communication. So if we're looking at using the basic telephone and perhaps telemedicine point of contact as part of that, I'm looking at continuity of care being so important. So if this is to be done in such a way that that would be the means of communication, would the patient therefore have numerous different contact, whenever they contact, perhaps it's a different nurse practitioner or a different doctor? How is that going to work to maintain and sustain continuity of care so that such a patient wouldn't have to continue to tell their same story over and over because they're contacting at different times different people?
Great question. I think that's the conundrum. That's the real issue, right? Is that making sure that all the information is available for all of the providers and that everybody sees the same information. So you know what the nephrologist said, you know what the cardiologist said, and they're all speaking that same language. So that's a real issue. I think one of the things when you've got these silos of data, one of the common factors in all this is the patient. And so, when you think about home care and home care services that people come in, perhaps there's a record in the home. Perhaps there's a tablet in the home that the family can access. And I hear you, and you're absolutely right. There are some people who are not comfortable with technology, and not necessarily an age thing, but some of them can't for whatever reason. In some ways, technology makes it more accessible. In some ways, people are just not comfortable and can't do it. So we need to recognize that. But if you have a mechanism whereby the family and the patient and the nurse, the VON nurse who's coming in and the family doctor and everybody accesses that same information, that's going to be very useful. But the continuity of care is a big, big challenge. It's a big challenge on paper. It's not as big a challenge on in a digital age, but there are incredible challenges around that. Absolutely.
Well, continue your excellent work, and it's going to be moving forward, and that's the important part, and I just wish that I could be around to see it.
Oh, I hope you will be. I'm sure you will be. Thanks so much.
with your national research, the big data, it seems that even you have some hard line to show the statistic to those provincial policymakers. So let alone those academic research and small research centers. So just based on your experience, what do you think, if mere cost-effective data won't change their mind, what is the more effective steps that we can take to those policy change makers and change their mind, and what can we do as a next generation to move that forward?
I love that question. So thanks for that question. I think, in terms of what will convince the policymakers and the adverse governments, and my thing, and I was at a conference and somebody said the healthcare system will not change from within, and I tend to believe that for a lot of reasons, and not for lack of desire, but it's hard, and we sort of get ingrained in that failure of imagination. I think the thing that will change the healthcare system is us demanding and wanting and not tolerating what the status quo, and not in a negative way, and I don't mean that we've got to bang down doors and be nasty and mean, but I think if we all work in the same direction, again, have that singular focus, and so, and young people especially, and I don't mean young people from a demographic perspective, but if people, you know what you want and you know what you need, and so it's, and lots of people have said, this isn't working for me, I'm going to invent, and that's what a lot of these initiatives do. That virtual reality, example I gave you, it's something saw a need and said, I have the ability to do this, I can solve this, I can resolve this. And so the tenacity of some of these young innovators that come up with these ideas, but then they say, well, I don't know anything about the healthcare system. And the privacy legislation? So giving them advice is something that's really important to do. But I think public attitudes and pushing and us wanting those kinds of things will shape and help. We will tell the politicians what we want and what we need to have change in the system. My own personal soapbox.
So just a quick question, I don't know if it's pertinent or if you can answer, but in terms of strategic planning, so from our position, what would your recommendations be for starting point? If we're starting from ground zero up, where would our biggest focus is, like how should we structure that? What would our priorities be? Just if you had any ideas.
Well, I'm glad I'm not having to do your strategic plan. But, I would, and first of all, you're not starting from ground zero because there's a ton of really, really great stuff that's happening here. And so that would be my first comment. The second thing is that, I would say focus on that patient experience and what will make the experience better for a patient, and whether it's something that costs millions of dollars to implement a solution, or whether it's just better signage, and ask patients what they're looking for, and really that's where I would start. And have a steering committee and have speaker series and have an engagement process. That's what I would do. Great, thanks very much.